is now starting. All attendees are in listen-only mode.
Good morning, everybody. Thank you for being with us today on November 19th for this press briefing from the Unified Command and the Joint Information Center and, of course, Maricopa County Department of Public Health. My name is Fields Mosley. I'm the lead public information officer during the pandemic and for the Unified Command right now, which includes public health and the Department of Emergency Management here at Maricopa County. We'd like to thank everybody who's joining us, whether it's on YouTube or Facebook, and, of course, the reporters joining us on the webinar to ask questions. We continue to try to answer all your questions via email and scheduling interviews when we can. Of course, everybody at Public Health very busy as we gear up for a number of efforts through the busy winter months and with the increasing caseloads that we've seen in the last month or so. So today I have Marcy Flanagan. She's the Executive Director of the Department of Public Health available, going to make a short presentation, then answer as many of your questions as we can. And we're going to talk a little bit about the saguaros survey results and what that means. Also offer some guidance for behavior over the holidays and discuss that a little bit. And we'll explore that and certainly talk about other activities that always happen during our mild winters here in Arizona. We know we're a little bit different fit than the rest of the country, and so we understand that a lot more activity happens here in the winter than perhaps it does other places. So also with us today for the question and answer portion, I have the Director of Emergency Management, Robert Rowley. If any of the reporters have questions for him about personal protective equipment and those supplies and how we're still distributing those at this time, none of that effort has stopped. So he's available as well. And I also have our Spanish translator, Joanna Molina, on hand, and she will translate answers into Spanish after we get to that portion. So it's been a while since we've had a press conference, so a couple of reminders, housekeeping reminders here. Members of the media, reporters, they'll be called on by our moderator to come in and ask their questions. Please unmute your microphone on whatever device you are on, and we will be able to hear you here, and then we'll unmute you on our side and allow you to ask your question. So I appreciate that, and if you raise your hand, to let us know that you have a question. And if you're having some trouble with that, sometimes the software is a little bit wonky, so you might have to log out of the GoToWebinar, log back in if it's just not working correctly. So we appreciate your patience with that, but we can't control what's happening on your device. So with that, I would like to invite Executive Director Marcy Flanagan to come to the podium and make a short presentation, then we'll start our question and answer period.
Good morning. So in partnership with Arizona State University and Mayo, the Maricopa County Department of Public Health successfully completed our COVID-19 sero survey. We were able to enroll 260 participants from 169 households. This represents the entire Maricopa County, and the results indicated that 10.7% have detectable antibodies of COVID-19. This tells us that for every one case that was reported to public health, there were 3 to 4 cases that were not reported to public health at the time the sero survey was conducted. The number of true infections in our community is far higher than the number of people who are being tested. Unfortunately, though, 11% is not even close to reaching natural herd immunity in Maricopa County. There are estimates that herd immunity of COVID-19 could be anywhere from 50 to 80%, which would mean that 50 to 80% of our community would need to contract COVID-19 in order for natural herd immunity to occur. Trying to reach natural herd immunity without a vaccine will result in many more infections, an unsustainable strain on our healthcare system, and a large number of deaths that could be prevented. Trying to reach natural herd immunity without a vaccine is not a feasible plan. That is why having a vaccine is so critical. Since we don't know if having antibodies to COVID-19 means you can't get reinfected or how long your immunity lasts, Public Health recommends that when a vaccine becomes available, people get vaccinated for COVID-19 even if they had a positive antibody test. The increase we've seen in new cases has been extreme. Our 7-day average is now over 1,500 new cases per day in Maricopa County. Just one short month ago, it was under 500 cases a day. This increase is concerning, and we are already seeing increases in hospitalizations and deaths. At Public Health, we are asking everyone to do what they can to help slow the spread. There are many things that as individuals we can't control, but we can control our own behavior. Even if you are at low risk, that does not mean you have no risk. We've seen hospitalizations and deaths in every age group. It's important that we come together as a community and help protect each other, especially our most vulnerable. While there is a mask requirement countywide, we have all seen and heard about situations where people were not wearing masks and maybe weren't even social distancing. For example, we know this weekend alone, there are nearly 800 youth sport teams coming to Maricopa County for competition. It's important at these events to wear masks even when you're outside and socially distance as much as possible. Having these events that aren't socially distanced and not wearing masks is how we end up with increases we're seeing, even with the current mitigation efforts in place. Wearing masks is not anybody's first choice, but for now, even though we're tired of it, it's what we can do to help flatten the curve and stop it from spreading even more. All of the little decisions we make, whether we go out to eat with a friend or connect with someone in person, they all add up. Please think very hard about situations where you're going to be around other people and do what you can to reduce your risk and make the right decision for the people who love and trust you to keep them safe. The decisions we make as individuals affect our hospital system capacity and our schools being able to stay open. As we move into the holiday season, we know that we are all yearning to be with our family and friends. The safest way to celebrate Thanksgiving is by not getting together in person with people from outside your household. If you do get together with people outside your household, please take as many precautions as you can. Meet outdoors and keep people from different households at least 6 feet apart. Have each household bring their own food, or have one person serve food for everyone to reduce the number of individuals who are touching shared utensils. Wearing masks when you are not actively eating or drinking, and minimizing the number of guests. Wash your hands and use hand sanitizer before preparing, serving, or eating food, after eating, and anytime your hands get dirty. We all know this holiday season, we want to be with our loved ones. We miss our families, we miss our friends, we miss our social events. We are still in a pandemic. We need to make tough decisions to stay vigilant and safe. It's a good time to still get your flu shot if you haven't already. We have free flu shot clinics throughout Maricopa County, and you can find more information on our website at maricopa.gov/coronavirus. Finally, if you would like to help those in need this holiday season, please consider donating to local organizations that help serve those most in need. Thank you.
Thank you, Director Flanagan, for that. I understand we're having a little bit of audio trouble on our Facebook feed, and I apologize for that. We do have a microphone. We detached it from the phone and or the device, and then we hooked it back up. So if you're having trouble hearing, we apologize. We do have a feed that's live now on YouTube as well. So we're simulcasting this, and hopefully one of those feeds can work out for you. It's a little bit difficult to tell what it might be in this case. So with that, we have, it's time to have some questions. And Ron, are we ready for that?
We are Fields. First up, Brian Webb. Brian. Your mic is unmuted.
Hi, thanks for taking a couple of questions. I don't know who best, but a couple quick ones if you don't mind. One is on contact tracing. Is that still happening? Is it the system being overwhelmed? And do you think it is helping in any way? And secondly, how do we combat people who still are not fully on board that this is a serious problem, a serious public health issue? Those two questions. Thank you.
All right, two very good questions and very important to these efforts that we have going on with the Department of Public Health. Director Flanagan will come up and answer those questions.
So our contact tracing efforts, case investigations are still happening. What we are experiencing more so now than we were early on in the pandemic is that individuals are not wanting to share who their close contacts were. So we can't stress enough the importance of sharing with public health when you do receive a call, not only to answer that call, but also share who your close contacts were so that we can reach out to them and let them know that they were a close contact of a case. We have the capability to expand through our partnerships with ASU, our own staff, and ADHS to continue those efforts. But as we see spread widen in our community and the numbers we're seeing, contact tracing and case investigations become more difficult and more difficult to control. The second part of the question was about... Anyone?
About
Sorry.
Getting people to believe this is a real risk.
Oh, yeah, so sorry. Thank you for the reminder. So this is absolutely a real risk. I think all you need to do is talk to anyone that works in a healthcare setting, talk to any individual that is an epidemiologist or works in public health, or family members who have lost loved ones to COVID. I know it's very frustrating. I have two of my sisters that both work on the front lines in hospital systems, and I hear from them daily their fear for contracting COVID-19 or having one of our parents contract COVID-19. So it's real, and you can talk to anyone in any of those situations to know that this is real, and it's very important, especially as we move into this holiday season, to remember that and help keep our loved ones safe.
And we'll have Joanna Molina come up. She is an interpreter with Public Health.
Son dos preguntas en una. La primera es que sí, ¿cómo se da seguimiento a los casos que han estado expuestos de COVID-19? ¿Cómo va ese proceso si lo seguimos haciendo? ¿Y cómo combatimos o cambiamos la mentalidad de las personas que piensan que esto no es serio, que esta pandemia no es algo serio? Bueno, hay varios puntos. Los expertos de dar seguimiento a los expertos de epidemiología siguen trabajando arduamente, contactando a las personas que han contactado COVID-19. El problema es que muchas de esas personas no dan la información correcta, no quieren dar la información de las personas que pudieron haber estado en contacto con ellos. También tenemos la capacidad de expandir con otros socios en caso de que se necesitara. Estamos hablando de socios como la Universidad Estatal de Arizona. Y también es difícil cuando la gente que tiene COVID-19 y que es contactada no da la información correcta. Así que les animamos que si usted recibe una llamada de algún departamento de epidemiología, que por favor dé los datos correctos para poder frenar esta pandemia. También le queremos pedir a la gente la que piensa que no es algo real. Realmente la pandemia existe y le pedimos que si usted no cree, solamente escuche los testimonios o hable con familiares que han perdido a un ser querido por COVID-19. También hable con algún departamento de salud, hable con alguna enfermera, con algún doctor y pueda ver realmente usted de primera mano los efectos de perder a un ser querido por COVID-19, especialmente ahora que estamos entrando a las fiestas de fin de año.
Joanna, thank you. Brian, thank you so much for the two good questions. Ron, do we have somebody else?
Yes, Fields.
Yes, Fields. Next up, Michael Pelton. Michael, your mic is unmuted.
Michael, do you have your mic unmuted so we can hear your question?
Can you hear me now? You got me?
Yeah.
Cool. All right. Hey, I appreciate you guys taking the time. Question for the director. We talked at the end of October, and you had mentioned to me that, if we continue the rise in cases over the next couple of weeks, we may get to a point where we're asking the state or the governor, what more can we do? Where do you stand on that now? And has the county requested that the state or the governor put in additional mitigation efforts?
Michael, I think the easiest answer for that is that public health has a constant dialogue, once a week, if not multiple times a week, depending on what they're discussing with ADHS, and not so much a direct line to the governor's office. So have they been speaking and partnering with various things? Absolutely. Are we making preparations and planning for COVID-19 vaccine to enter our community? Absolutely. So those are the things that are going on, and there's this constant discussion about the rise in cases as well. We recognize that the governor has 15 counties to worry about in this state, and not all of them are like Maricopa County, of course, where 2/3 of the population of the state resides. So we understand that he has different communities to worry about and think about, and but that dialogue goes on with ADHS on a constant basis. And Joanna, you want to come up?
Bueno, la pregunta es, con el incremento de casos que hemos estado viendo en las últimas semanas, habíamos dicho anteriormente qué podríamos hacer para continuar con la mitigación, los esfuerzos de mitigación. Y si estamos en comunicación con la oficina del gobernador. Bueno, nosotros hablamos con el Departamento de Servicios de Salud constantemente, hacemos los planes de mitigación, también se comunica con la oficina del gobernador. Cabe mencionar que el gobernador tiene otros 15, somos 15 condados en Arizona y no todos son como el condado Maricopa. Así que la oficina del gobernador se enfoca en el bienestar quizás de toda Arizona y no necesariamente solo en Maricopa. Pero sí estamos en constante comunicación con el Departamento de Servicios de Salud del estado y haciendo estos planes de mitigación.
Thanks, Mike, for the question. Ron, do we have somebody else?
Yes, Josh Sanders. Josh, your mic is unmuted.
All right, am I good to go?
Go ahead, Josh.
Okay. This is for Flanagan, and I follow-up question, if I may. But the director mentioned that 800 youth sport teams will be coming in to the state next week, knowing that the virus is widespread right now. Why is this responsible to allow these tournaments to still take place? And at what point will you cancel these tournaments?
So, Josh, let me be very clear about what the public health at the county level is not an enforcement organization. Can we kill that audio real quick, or is that his audio bleeding back?
It was his feedback.
Okay. So, yes, public health is not an enforcement organization. This is an organization that studies the spread of disease, monitors the spread of disease, provides guidance to community leaders and policymakers, and therefore they can make decisions on how that should happen. We do know that this is, I know as a parent, that this happens every winter. Winter sports come here to Arizona to have tournaments of all different kinds because of our mild winters. So this is, if I understand it, this is not restricted at this point at the state level, and but this is still continuing. Director Flanagan might want to add to this, but as far as the public health point of view, when we talk about social gatherings, that includes standing on the sideline cheering on your children. And all of the recommendations that public health has provided for protecting yourself, just because you're standing outside, if you're not maintaining 6 feet of distance, if you're not wearing your mask, then it might not be working and you might be putting yourself and your family at risk. And so when you talk about teams and their families traveling here, you're talking about a potentially risky activity. I'm certainly not going to pass judgment on the folks that are doing this, because sports are great for our kids and our kids need it right now. They need something. So I think understanding, though, that public health's role here is to advise people of risky behavior so they can take precautions. We know that masks work, and they can take precautions at this time and keep themselves safe if they're going to participate in these activities. Director Flanagan, do you have anything else to add to that? All right. So, Joanna, will you want to step up and answer that one? And then if Josh has a follow-up question, we'll deal with that.
La pregunta es que si llegan 800 equipos deportivos que próximamente estarán aquí en Arizona, en el condado de Maricopa, ¿por qué se permite cuando se está incrementando el número de casos de COVID-19 y cuándo se decide cancelar este tipo de eventos? Bueno, cabe mencionar que Salud Pública del Condado de Maricopa no enforza leyes. Lo que sí hace es informar y monitorear las enfermedades y dar la información a las autoridades correctas. Esto no está restringido a nivel estatal. Cuando hablamos de reuniones que son, aunque sean fuera, en un espacio abierto, lo que estamos recomendando sigue siendo lo mismo. Mantener el distanciamiento físico de 6 pies unos de otros, usar las mascarillas. Sin embargo, si hay un evento masivo donde hay mucha gente reunida, aunque sea fuera, al aire libre, pudieran estar en riesgo, aunque le estén echando porras a sus hijos en los equipos deportivos, en ese tipo de eventos. Así que hay que tomar las precauciones pertinentes, entre ellas el uso de la mascarilla.
Thank you. So, Ron, I believe Josh had a follow-up question.
One moment, please. Josh, your mic.
Okay, thank you. I appreciate that response, but so I'll just ask the question though again this way, along with my follow-up question. Is it responsible to hold these sports tournaments knowing that we are living through another surge of this unprecedented pandemic right now that is, the average of 1,500 new cases in Maricopa County alone the last week, and that more than 6,000 Arizonans have lost their lives to this virus? Is it responsible to hold these tournaments? My follow-up question is based on a November 18th model that came out of the U of A looking at the state that have found that if new viral transmission is not addressed with further mitigation, new cases will overwhelm and erode Arizona hospitals, and the state will be headed for a major crisis within weeks. And I'm wondering if Maricopa County, holding 2/3 of the state's population, feels that the state needs to scale back and return to some of the mitigation efforts that we had early on in the pandemic and in the middle of the summer.
So the second one's a complicated question. So let me have Director Flanagan come up here and address a couple of these things for you, Josh.
Thank you.
Thank you for the questions. So I think I can answer both of them a little bit, with the first in that we all need to think and take responsibility for our individual decisions and actions. From a public health standpoint, is there a safe way for our students to be involved in physical activity? There are, and there is a safe way for that to happen. Is that happening at all of these tournaments? From reports we're hearing, it's not happening at all of these tournaments. So that's when individual responsibility and decisions are really important for parents and athletes that are participating in these events. From the standpoint of the new model that came out on the 18th, I have not had a chance to review that or see that, but I can tell you that the numbers we're seeing and the trajectory we're seeing, when our hospital systems become overwhelmed, we will have to do additional efforts statewide to help those systems relieve the pressure. We certainly can't continue to have increase in numbers and get to a point where our hospital systems cannot see patients and do not have enough beds and staff to care for those patients in their systems. So at that point, certainly additional mitigation efforts would need to take place, or something would need to happen. And as Fields already mentioned, we have biweekly calls with ADHS where we talk about statewide what the outlook is, and obviously with Maricopa County being the largest county, we do really concentrate on what's happening here and what's happening with our healthcare systems here, since other counties do rely on our healthcare system when theirs become overwhelmed. So we do have those discussions, and there is certainly the benchmarks in place right now that say once spread reaches those areas that things will change. And so it's really important to keep your eye on those benchmarks that the state has set.
Sí, la pregunta son dos. Si es posible tener ese tipo de eventos deportivos cuando estamos viendo el incremento de casos y también acerca de la transmisión del virus de un modelo de la Universidad de Arizona que se dio a conocer el 18 de noviembre, que avisa que estará saturando el sistema hospitalario si sigue subiendo el número de casos de COVID-19. Y si es necesario que regresemos a los esfuerzos que tuvimos precisamente de mitigación en el verano. Bueno, en este caso, las respuestas vienen siendo, todos tenemos que tomar responsabilidad. Todo el mundo tiene un parte de responsabilidad en esta pandemia. Si es necesario, si se puede tener actividades deportivas con los estudiantes de forma segura, sí existe la posibilidad. Pero lo que estamos escuchando y lo que está pasando es que los padres de familia y los estudiantes, quizás no todo el mundo esté siguiendo las guías adecuadas. También no hemos visto nosotros el modelo que dio a conocer la Universidad de Arizona el 18 de noviembre, pero sí tenemos que tomar en cuenta que si se satura el sistema hospitalario va a ser mucho más difícil para atender a pacientes que lleguen. Entonces, tenemos la comunicación quincenal con el Departamento de Servicios de Salud de Arizona, donde se habla de este tipo de situaciones y cuáles serían las respuestas. Sabemos que al momento tenemos que mantener la vista en los parámetros que se ha puesto el Estado para poder parar esto en un tiempo adecuado todavía.
Josh, thank you for those questions. Ron, do we have somebody else on the line?
Yes, Peter Seymour's up next. Peter, your mic is unmuted.
Yeah, thank you very much. So my question goes along the benchmarks that Marcy Flanagan just mentioned. You think it's time to maybe tighten the benchmarks for schools, restaurants, and gyms to stop the spread? Maybe encourage them to close, faster in order to stop the spread? I know some schools are already doing this on their own, but maybe if we change the benchmarks, it would encourage that. And then a quick follow-up, how fast will the county get the vaccine from the state? I know the state's administering it, but what proportion will the county get the vaccine from the state? So those two questions I have. Thank you.
Okay, so Peter, on your first question, I would refer you back to the state. ADHS set the benchmarks. We have put out the benchmarks. I certainly think at this point, moving the goalposts on any of these organizations, particularly schools, which your local public health departments deal with all the time, that is not the plan or would not be fair. This is about having discussions. We've reiterated many times. There's not a one-size-fits-all approach when it comes to giving advice to schools or the businesses or the people that seek that advice from the Department of Public Health. So, but moving the benchmarks, the benchmarks are there so you know where you stand. You have to have the benchmark somewhere, and that's been set early on in cooperation with ADHS. And so if you have any questions about if those are going to be changed, I would encourage you to reach out to the state level. Marcy and Director Flanagan, do you want Joanna to answer first? And Joanna, why don't you answer that question first, and then we'll have Director Flanagan come up and talk to you a little bit about vaccine distribution and what we're hearing.
Son varias preguntas, pero contestaremos la primera y regresaremos. ¿Es acaso que los parámetros que existen, como lo mencionó ya la directora Marcy, será tiempo en que cerremos los restaurantes u otros sitios? Y también si algunas escuelas ya lo están haciendo por sí solas. Bueno, la respuesta a esto es que el Estado es el que se encarga, el Departamento de Servicios de Salud es el que se encarga de poner estos parámetros y ellos son los que pueden cambiar. No todo el plan puede ser para todos, cada uno es específico, entonces no se pueden cambiar los parámetros esperando que todos vayan a caer en el mismo plan. Así que son todas decisiones que se tendrán que tomar a nivel estatal. Y si siguen teniendo algunas preguntas acerca de esos parámetros, la respuesta la podrá tener el Departamento de Servicios de Salud del Estado.
So the question about the vaccine, obviously we've all heard the very promising news about the vaccine from Pfizer and Moderna, and those, as soon as they receive clearance from the FDA, which we are hearing will take at least 2 weeks once they apply for that clearance, as soon as it arrives in Arizona at the state level within 24 hours to 48 hours, we should receive our local allotment. That allotment is based on our ability to store and administer the vaccine, which in Maricopa County we're very well positioned and situated to be able to store and administer all the vaccine that we receive. And so when that comes to us, that's when we will then implement our COVID-19 vaccine plan.
La pregunta es que si cuándo llegará la vacuna de COVID-19. Cabe mencionar que las dos agencias, Pfizer y Moderna, ya dijeron que tienen una vacuna disponible y que ellos necesitan tener el permiso de la Administración de Drogas y Alimentos para poderla distribuir. Se tomará al menos 2 semanas para que ellos puedan tener este permiso. Luego podría llegar a nosotros todavía dentro de 48 horas. Pero estamos listos para poderla administrar y también asegurar y poder dársela al público cuando llegue a nuestras manos.
Peter, thank you so much for the questions. Ron, do we have somebody else?
Yes, Felix. Allison Steinbach is up next. Allison, your mic is unmuted.
Hi, thank you again for doing this briefing. I have a question. I'm wondering if you could talk a bit about what sorts of trends you all are finding through contact tracing. So are you seeing any patterns of sort of where transmission is occurring? I know you mentioned youth sports as one possibility. So I guess what sorts of clusters or patterns are emerging?
Okay, thank you so much, Allison, for the question. Director Flanagan will address at least what we believe we can release at this point as far as looking at those patterns. As we've stated many times, of course, we're often looking forward and trying to inform people when they might have been exposed and what they can do to protect themselves and their families. But I'll let Director Flanagan expand on that.
Thank you. So the trends that we're seeing are not just through our contact tracing, but it's our case investigations. And the reason I mentioned the youth sports is we have several outbreaks that we have identified have been associated with club sports and club sporting events. We've seen that increase over the past month. We've also had outbreaks in our schools, the majority of those being in our high schools and our high school age groups. And so that really tells us it's that social sort of behavior outside of schools and on the weekends and after school that are contributing to the higher numbers we're seeing in those age groups, those high school, college age groups.
Bueno, la pregunta es que sí, ¿qué patrones estamos viendo con el seguimiento que damos a los casos de COVID-19? Si es que existen algunos patrones. Y sí, los patrones que se están viendo al momento no solo es cuando se da seguimiento a los casos, sino también cuando se hacen investigaciones de enfermedades o brotes. Hemos estado viendo brotes en diferentes tipos de actividades, especialmente en clubes deportivos, en escuelas como preparatorias también, y eso nos dice que el comportamiento de los estudiantes en actividades extracurriculares o fuera de escuela también está causando que veamos más números de COVID-19.
Allison, thank you so much for the question. Ron, do we have somebody else?
Fields, Ann Ryman is up next. Ann, your mic is unmuted.
Hi, good morning. Can you tell us how the case increases that you're seeing at long-term care facilities compare to the increases that we saw earlier this year? And I'm wondering, what sort of guidance do you have for people who want to visit a family member in a care center for Thanksgiving? Or if they want to bring a family member, you know, from the care center to their homes for Thanksgiving?
All right, Ann, thank you very much. Long-term care facility is certainly a number of organizations. I know we continue to have contact with those organizations within Maricopa County, and Director Flanagan will address these questions.
Hi, Ann. So we are not seeing the increase in cases and numbers in our long-term care facilities that we were seeing early on in the pandemic, which is very good news. We would recommend during the holiday season, if you're going to go visit a loved one that's in one of these long-term care facilities, there's a few things you can do. First would be to get your flu shot before you go. You can also get tested before you go to make sure you're negative. And we would really have you not bring them home, especially if you're going to have other households in your home that would be in contact with them. If you do bring them home, limit the number of individuals that they are around, have individuals wear masks, and really be careful with that loved one.
La pregunta es, ¿cómo va el número de casos o si están subiendo acaso el número de casos de COVID-19 en instalaciones de cuidado de largo plazo? ¿Y qué recomendaciones se dan si es que se tiene que visitar a un familiar en este tipo de ambientes? Bueno, al momento no estamos viendo incremento de casos en ese tipo de ambientes, pero si va a ir a visitar a un familiar, lo que recomendamos es que se ponga la vacuna contra la gripe. También que se haga la prueba de COVID-19 antes de visitarlos y que salga negativa. También limitar el número de personas, si es que usted va a traer ese ser querido a su casa, limitar el número de personas en las que está expuesto y, por supuesto, el uso de la mascarilla.
Thank you, Ann, for that question. I'm trying to wrestle with my mask here. Ron, do we have somebody else with a question?
Yes, sir. Christian Villegas is up next. Christian, your mic is muted.
Hi, can you guys hear me?
I can.
I have a two-part question here. What do you guys have to say to those individuals who are not getting tested because they are not having any symptoms? And how frequent would you guys suggest those individuals who are not experiencing any symptoms to get tested?
So thank you, Christian. So you're asking, you know, if we have recommendations really for testing. I'm not sure. I think Director Flanagan can expand a little bit more about testing. Sorry. All right, thank you.
Thank you for that question. So right now, our strategy is not recommending that individuals that don't have any symptoms or who were not exposed that they know of get tested. Our recommendation for testing is that if you've been in contact with someone who is COVID positive or if you have symptoms of COVID that you get tested. Otherwise, we are not recommending at this time that everyone just go and get tested.
La pregunta es, ¿qué les decimos a las personas que no se hacen la prueba y porque no tienen síntomas? Y también, ¿cuándo se deben de hacer la prueba? ¿Cada cuánto? Bueno, la respuesta es que nuestra recomendación al momento es que las personas que no tienen síntomas no se tienen que hacer la prueba. Sin embargo, la recomendación es que si usted ha estado expuesto, sabe que ha estado expuesto a alguien con COVID-19 o tiene los síntomas, se debe de realizar la prueba de COVID-19.
Thank you, Christian, for the question about testing. Ron, who do we have next?
Michael Pelton is back with a follow-up.
Okay.
Hey, just one quick follow-up. Question for the director in terms of what are you all hearing or what conversations are you having with hospitals in the county as it pertains to staffing? You know, we've heard concerns about having enough staff. So what conversations are you having with our hospitals and are there going to be enough extra people to help with an anticipated surge?
Thank you, Mike, for that question. We know that ADHS is tracking this at a statewide level, and so a lot of the data that we receive is via the state. And so I believe Director Flanagan can expand on my knowledge of our conversations with hospitals and their leaders and how they're dealing with the potential surge.
So we do have communication with our hospital CMOs weekly. There is certainly a concern that if we continue at this rate, that there will be staffing shortages. They are able to manage right now, and they do have capacity to adjust surgeries and schedules to account for the increase. However, there is concern if it continues the rates that there may be an issue with staffing. We are hearing that from our hospital partners. One thing I want to add to the last question about testing is that for individuals who may be asymptomatic, that's why the masks are so important. We don't recommend everyone just go get tested, but helping prevent asymptomatic spread is preventable with your mask.
La pregunta es, ¿qué comunicación o conversaciones están teniendo con los hospitales? ¿Y acaso habrá personal suficiente si surgen más casos de COVID-19? Bueno, sí tenemos comunicación con los hospitales y diferente tipo de personal médico. Y sí ha surgido ese tipo de plática, de conversación, que podría haber escasez de personal médico si seguimos al nivel que están creciendo el número de casos de COVID-19. Pero al momento sí tienen la capacidad de dar seguimiento en el sistema hospitalario. Con respecto a una pregunta anterior, queremos recalcar que el uso de la mascarilla es muy importante porque hay personas que quizás son asintomáticas y no se hacen la prueba y pudieran estar contagiando a los demás. Entonces, el uso de la mascarilla es muy importante en este caso.
All right, we have time for about 2 more questions. Thank you, Mike, for that question. Ron, who else do we have?
Is Josh Sanders back with a follow-up?
Go ahead, Josh.
I just wanted to follow up to the director's point of identifying certain sports teams within Arizona high schools where you've had spread and outbreaks, and knowing that there are a large number of school districts within Maricopa County that fall under that red zone. At what point is it time for students to go back to virtual learning only, and why haven't these districts made that decision?
So I believe that the conversation continues with school districts. Some of those conversations, they certainly start when they have 1 or 2 of those metrics in the red. And as you might know, the state has the metric level for making go back into virtual learning is at 3. So Director Flanagan, can you come up and say a few words about that?
So I just want to clarify that the outbreaks we've seen associated with sports have not been in high school sports teams, but in club teams outside of the school settings. The other thing is that, as Fields mentioned, we do have regular conversations with our schools, especially when schools have at least one of those benchmarks in the red. The ADHS guidelines recommend that when all 3 are in the red is when they go back to virtual learning. However, as you know, many of our schools have decided to go back to virtual learning with less than all 3 in the red. And that is a discussion that they have with public health. That's based on a lot of different factors that we look at when we're working with schools about whether it is safe for them to continue this hybrid model or to go to virtual. Staff resources become an issue, how many students they have in quarantine. There's a lot of factors that go into those discussions.
La pregunta es que si estamos viendo que los equipos deportivos podrán estar propagando la enfermedad, ¿cuándo se debe regresar entonces al aprendizaje virtual? Bueno, cabe mencionar que cuando hay 2 parámetros en rojo, al momento existen 3 en total, 3 parámetros que fueron diseñados por el Estado, y cuando existen 2 parámetros en rojo es cuando está en la conversación con las escuelas. Cuando están los 3 en rojo es cuando se recomienda que deben regresar al aprendizaje virtual. También queremos recalcar que los brotes que hemos visto en las escuelas no necesariamente viene siendo en los clubes deportivos dentro de las escuelas, sino fuera de las instituciones de las escuelas. Así que cuando Salud Pública del Condado de Maricopa ve a una escuela que tiene uno de los parámetros en rojo, la conversación se inicia y de ahí se toman decisiones para que si llegaran a tener los 3 parámetros en rojo, quizás puedan regresar al aprendizaje virtual.
All right. Thank you, Josh, for that follow-up question. We have time for the last question, I believe. And Ron, who is it?
Peter Seymour, up with the last question. Peter, your mic is unmuted.
Thank you very much. Just a couple of quick follow-ups. Number one, these 800 teams coming to the Valley this weekend, supposedly, is this a club tournament? Is this a soccer tournament? Where exactly in the Valley will it be? I'm just kind of curious if you have any information. And then number two, can we expand a little bit more on the vaccine distribution plan? Has that been publicly released yet? And which populations would get it first? I'm sure first responders and the medical community get it first, nursing homes and so forth, but what about beyond that?
All right, we'll try to expand a little bit on what we know so far. A lot of what we know about sports teams is anecdotal, just from you can do a Google search and you can figure out what tournaments are going on this winter, and so that's a starting point for looking into anything and offering advice on these sorts of things. Director Flanagan will come up and expand on that, as well as talk a little bit more about the COVID vaccine plan.
So just to reiterate what Field said about the sporting events, it is multiple sports that we have this information from, soccer, baseball, basketball, and it was just us hearing about it and doing some basic online searches after we had cases that were associated with these club sports. With the vaccine plan, we are working with our healthcare partners and our first responders on our COVID distribution plan. We will have 5 regional pods in Maricopa County to distribute the vaccine, and that first tier, Tier 1A, is going to be our healthcare providers and first responders that will receive vaccine first. That plan is until we get the vaccine and start distributing it. It is something that we are working with our partners on.
Son dos preguntas. La primera es que si están llegando 800 equipos o de club deportivos, ya de qué tipo de deportes estamos hablando, ¿sabe dónde están o quiénes son? Y también cuál es el plan de vacunación de COVID-19 cuando ya esté la vacuna disponible. Bueno, la primera pregunta vamos a contestar. Con tan solo hacer una búsqueda en línea aparecen múltiples eventos que estarán sucediendo este fin de semana. Estamos hablando de equipos de soccer, de básquetbol, de fútbol también. Entonces, con tan solo buscar en línea podemos encontrar diferente tipo de actividades, ¿no? De clubs, de deportivos. En cuestión del plan de la vacunación de COVID-19 cuando esté disponible, el condado de Maricopa tiene 5 puntos de distribución y los primeros que serán o que recibirán la vacuna son los que son proveedores médicos y equipos de bomberos o primeros auxilios.
All right. Thank you for those questions, and thank you, everybody, for joining us today. We appreciate your time. We appreciate all the good questions. We hope we've been able to provide some answers that really help you better understand our situation right now, and certainly with the high number of cases, the concern that public health has, and the information that we need to get out there to hopefully curb these high numbers of cases. So we appreciate it. And one more reminder before we go. Marcy mentioned this briefly at the end of her statement, but the Healthy Giving Council is a group of individuals, religious organizations, nonprofit organizations, and then some government liaisons that are in there. But they have a strong message this holiday season. If you're going to give and participate in charitable activities, we appreciate that. There are a lot of fantastic organizations that could use your volunteer support or your financial support, and that's really encouraged as opposed to going down and to a local location wherever you might live in the Valley and giving food or other things directly to people in need. There are a lot of organizations that are doing that and serving up 3 meals a day, and they always have needs to make sure those efforts are met and those needs are met in our community. So if you have any questions, you can go to givesmartaz.org. That's always a great place to start, and there are lists of organizations there, and also toolkits if you're interested in sharing things about that effort as well. So we appreciate that. Thank you, everybody, for being with us today. Those of you on Facebook and YouTube, thanks for joining us as well. And we'll be in touch. And if you're a member of the media, you can always reach out to the Joint Information Center. Thanks.